The most recent numbers from the Minnesota Department of Health show the number of new COVID cases continue to rise. The latest data shows more than 2,100 new cases, but just as troubling, the number of ICU beds with COVID patients is also rising. And this latest surge is having an extraordinary impact on hospitals. At Methodist Hospital, it's as full now as it's been during any time at the pandemic. And both doctors and nurses are telling me it shouldn't have to be like this. At the very place that strikes notes of compassion.
Very draining. It's been draining.
Another wave of COVID is testing both emotional strength and medical capacity.
We are in the midst of what I would call another surge.
Lori Bells is the Methodist Hospital nurse manager on floor 6 West. This is the med surge unit, all 28 rooms.
Well, they're all full, but 19 of them have COVID positive patients today.
On a floor of nearly all COVID patients, nurses now monitor a bank of oxygen sensors from a wall of monitors that resemble a small television studio. It's one of the many medical innovations of the pandemic. But even with the technology and improving treatments, COVID disease is still a medical monster.
I think that's the biggest thing I can tell you is it's very unpredictable for each person. And we just do our best to help treat and get everybody on the road to recovery.
Tragically, some get worse. 4 floors down in the intensive care unit, several patients are struggling for their life. There's barely room for more.
Right now, we're 1 bed in, 1 bed out, so we're pretty much at capacity.
There are 22 ICU beds, and on this day, 5 are treating COVID patients. The surge comes as Methodist Hospital is also serving more non-COVID patients. And Dr. Mark Sanis says that's putting pressure on the entire system.
We are seeing the hospital right now as full as it's been really at any point in the pandemic.
It's a trend at hospitals across Minnesota. According to the latest Department of Health data, there is a 7,400 bed capacity across the state. As of Friday, 6,800 beds were full. Likewise, 1,100 ICU beds were occupied, just 78 shy of total capacity. Many of those cases are preventable. Of the patients that are here for COVID, how many of them have had the vaccine?
Really only 1 patient here in the ICU, and that's really been our case this summer. We think of 1 patient who was vaccinated who did end up on a breathing machine. All of our other COVID patients have been unvaccinated.
And doctors say that's what's leading to the surge.
We're in this one right now, though, because of that last third. This virus is looking for targets. A third of the people out there are still targets.
That means more patients getting sick with COVID.
It's traumatizing, and you think, I don't know how much I can take of this.
Lindsay Mastos has worked in the Methodist Hospital ICU for 19 years. It's never been as emotionally draining as it is now.
This last weekend, having 1 death on Friday, and then, I couldn't even be in the room because I was stuck in another patient's room, and this poor person died peacefully, but I couldn't even be in the room to hold his hand.
The nurses admit they've all had to build emotional walls to get through the surges, but even the toughest of walls develop cracks.
I'm going home and I'm having to cry to my husband, and the moment you let your guard down, you feel it all, and it's overwhelming.
And this is perhaps the toughest fight.
I think for our staff, for their morale, it's just so difficult to see patients dying who we think we may have been able to prevent it with the vaccine.
All in a respected hospital, fighting the latest COVID surge, where the care teams are in search of compassion as well.
Yes, patients need help, but we need help to be here at the bedside to care for them, because we're losing our soul, we're losing our strength to be able to keep doing this.
And Dr. Sanis believes that they are likely to see more cases during the next 2 weeks, which is why he's asking those who don't yet have their vaccine to get it now to prevent themselves from becoming the target.